Oh, hey, Annette, how are you?
Hi, how are you?
Nice to meet you.
You too.
So, how are you doing?
I'm good, considering everything that's going
Yeah,
on.
yeah, for sure. Are you in the kind of New York area?
Yes.
Okay, all right. So, surviving?
Yeah, doing what I can do.
Yeah, I hear you.
How about yourself?
Yeah, doing okay. Continuing to lose my hair, but otherwise
Oh,
doing fine.
yeah.
But yeah, no, I mean it's been okay. A lot of family time. I went bike riding along the West Side Highway there today, so it's not all bad.
Okay. Yeah, yeah. We've been doing a lot of walking and stuff like that and exercise and stuff, so it's
Yeah, I
actually
mean,
not
we
bad.
can we do what we can do, right, in New York
Yeah,
to try to
exactly.
stay
Keep
active.
ourselves as busy as we can.
Exactly, exactly.
Yeah.
So my understanding is that you're interested in the lip lift.
Yeah, I've been looking into it. I got a couple of fillers about 3 times, and I feel like every time I do get the filler, it just kind of weighs my lip down, and it gives me I don't know, it just doesn't look nice. It
Yeah.
looks like it's done.
When did you start getting fillers? About how long ago?
About maybe 2 years ago.
And like, what were your original sort of goals when you started getting the filler? I mean, what were you hoping to achieve? Just a bigger lip, or?
I kind of just wanted a fuller lip at the top, just sort of
Mhm.
like right in this area here.
Okay,
But I felt like every time I got it, it was just this way outward, and then they would fill the lip on the bottom, and it would look too big.
got
And I
it.
really
How
wasn't
fre
going for that look.
Right. I see. How frequently were you getting the filler,
Not
approximately?
often. Like I got it all of 3 times, and it was probably every 8 months, I want to say.
Okay, and which product were they using?
Juvederm.
Okay. So you just felt like it was extending your lip out forward and kind of weighing things down and
Yeah,
covering
it
your
just
teeth and
just wasn't giving me a nice look. I felt like it looked fake, and I didn't want to look fake.
right. Have you had them dissolve the filler?
Right now, I haven't put anything in it for about, I want to say 8 months, 6 to 8 months.
Hmm.
I've been trying to let everything come out.
Yeah, got it. And how did you find out about the lip lift?
I was just looking online one day because I heard, where did I hear about a lip lift? I'm trying to remember. I think a friend had told me about it a long time ago.
Yeah,
And then I was like, you know what? Let me just see what other options there are. And I looked and I found Real Self, and I found you and there were a few other physicians in the New
sure.
York area.
Yeah. Well, very cool. So what do you, I guess, know about the procedure? Let's start there. And then what questions do you have? I guess we'll
So
go from there.
I do know that the typical one is the bullhorn that goes straight across the nose
Right.
here. And they have a few different ways of doing that, modified, Italian, all
Sure.
those kind of ways.
Sure.
And it shortens you through here, and it kind of gives you a little lift. So
Yeah.
I thought that was probably, I mean, I do have a little tooth show,
Hmm.
so I wasn't sure if that would be an option for me. I don't
Hmm.
know if, it would make it go up too much.
Yeah, no, those are all good questions. Have you had a chance to measure this distance by any chance? Some people do, some people don't. So I just asked.
No.
Yeah, that's fine. No worries. So, I mean, just by kind of looking at the area, it definitely seems long enough to operate on. That doesn't mean that, you need surgery. It just means that, there's room there to remove some skin and you'd still have enough skin remaining, right? That's a really important point. Yes, the teeth will basically become more visible. So some people don't want that, but you can't get both. So some people tell me, well, I don't want more tooth show. I just want more of my lip, exposed. It's impossible. It kind of goes hand in hand. So that's something to keep in mind. That being said, some people worry that, oh, we're going to expose the gum line. It doesn't really happen. I mean, we're
Yeah, I didn't
careful.
think it did. Yeah, I wouldn't think that
You'd
would
have to
really.
remove a lot, for the gum to show. So, but it's all about keeping things in balance, kind of keeping the face harmonized, especially the lower third. So take into consideration sort of like the overall proportions of the face as well. But it's really about keeping this distance, short as we need to go by revealing more of your upper lip and also making sure that you're not getting too much of the tooth show.
Okay.
All right, so it's just about balancing that out. And in the office, I basically do like a little simulation with the fingers on the face, and we get a sense of, how many millimeters we would need to remove to accomplish, what we're sort of going for. So those are the general kind of, principles here. What other questions do you have?
So my concerns are, I mean, I did look at a lot of photos, and big concern is scarring and
Sure.
also like a little nose distortion. I did read a couple of reviews where a lot of people, you know, said something with the nose, had little nostril flare. And I mean, I like my nose, so I
Yeah.
kind of just don't want to disturb that, you know, and if that would be a problem, that's my fear.
So excellent points, both very well taken. I mean, the first, scarring. Any incision on the face, or really anywhere on the body, if it's deep enough, is going to leave a scar. Now, some people heal really, really well. And if the surgical technique is good, if the patient just has good healing qualities, it's going to result in a very thin white line that's kind of imperceptible. That's always the goal. But even in the best of hands, it's not always achievable. I mean, sometimes the scarring can be a little hypertrophied, which means that it's raised.
Yeah.
Sometimes it can be a little indented, and those are all possible things with the lip lift. So it's not to say that surgery was a failure. It's just something to accept as a real risk of the procedure. I think people who do this more often have better looking scars most of the time, but we all run into some problems here and there.
Okay.
So that's important. So if someone doesn't want a scar on their face, this is not a great procedure for them. That being said, there are a lot of things you can do if there even is an unfavorable scar, which happens in a small percentage of cases, but it is possible. So there's laser resurfacing, there's microdermabrasion, there's also a revision procedure, usually that involves a much kind of less aggressive approach to correct the scarring, because you're not like removing a big chunk of skin. So there are things that can be done. So that's the good news. The bad news is that, you know, no one can promise you, you know, invisible kind of area there. So all kind of important points. And the other thing I always tell my patients is that the healing is gradual, especially at the actual incision line. So it's not like at a week, you know, you're good to go, and if you didn't put on makeup, everything would look perfect. But the goal is that about 10 to 12 days, you can start to use scar gel and use makeup on top of that. People really shouldn't be able to pick up that you had something done with that. But I mean, if you were just to kind of let it go, there'd be some redness there that can take months to get better. Some people laser the incision routinely. I don't do that because I think it's re-traumatizing the area, and I think it should only be done if there's an actual reason to do it. So I don't agree with lasering everybody, but that is something that can be done, you know, should someone, you know, require it or want it. I mean, some people have like a visible scar if they don't wear makeup, but they don't really care. So they're just like, I had my surgery, I'm done with this, I don't want any more procedures. And that's fine. So everyone's a little different in that regard, but it's totally normal and actually preferred for me when a patient is thinking about the scarring and, you know, understands that it's a real possibility. I mean, there will be a scar. It's just a matter of how noticeable will it be.
Right.
And
Okay.
it does get better with time. It's just that, you know, you just have to kind of be patient with it. And sometimes time isn't enough. That's what I'll say about that. But again, most people don't really need anything beyond maybe like a little steroid shot as they're healing at like a month or about 2 to 3 months after the procedure. And that's all they need. So that's about the scarring. Now, in terms of the nostrils, also great question. There's sort of what I see, you know, and I can really only talk for like my patients. Yeah, I mean, I see pictures of other people's work, and I see very similar, you know, sort of effects with the nostrils in good hands. I'm not talking about everyone doing lip lifts, but in people who I respect as, you know, good lip lift surgeons, it's the same exact thing. So in a fraction of patients, I'd say maybe about 10 to maybe 20% of patients, which is not a small number, there will be a little increase in the amount of like essentially black that you see on the frontal view, the amount of nostril show that you get, because as it heals, there could be like, you know, some degree of pull down from gravity. And so you could reveal a little bit more of the actual black part of, you know, of the nostril. That's possible. That being said, I've never had a patient actually complain to me about that. Even when it develops, you know, I might see it in a picture, but they don't really even notice it. So it's not really something people complain about. I have patients who worry about all types of things, that the nose will be wider, that it'll be crooked. I've heard a lot of different concerns, but none of them, at least with the technique that I use, are, you know, very like grounded in reality. So that's something to keep in mind, that most of the things you hear about and read about, at least with the technique I use, aren't something that happened. But with the nostrils coming down a little bit, more nostril show, that's very real. That could happen. Most people are not bothered by it. The other thing is, again, there are different techniques, right? So I can just speak for my technique primarily, and other people who use my a similar technique to mine. But there are people who make their incision at this sill level, they'll make it into the nose. So
Yeah.
they do that to hide it, right? So that's not as visible. But the problem is you distort natural anatomy. So this sill is important because it's like a little mound that separates the lip from the nose. We all have it to different varying degrees. Now, if you made the incision into the nose in that area, you've now obliterated that sill because now you pull the lip, right? You cut out that skin, then you pull the lip into the nose. And the whole sill kind of becomes flattened and starts to look artificial. So you've hidden the incision, but you've also changed the architecture of the nose. So
Yeah,
that,
I read that. Yeah. So that, yeah, I didn't really, that one I was like, okay, because I already read, that could have the same effect. So I didn't really look into that at all. But I did want to ask you one more
yeah,
thing about
yeah.
what's the Italian lip lift? Like, what is the difference with that one?
Yeah, good question. So the Italian lip lift does not involve the central portion. So it's just on the sides. So basically, instead of an incision that goes along the entire base of the nose, the Italian is just two lateral incisions, like two ellipses here and here. So first of all, you're not lifting the lip in sort of a harmonious way, right? Because you're just kind of lifting the side, so it starts to look a little bit distorted.
Okay.
First, that's the first issue. The second issue is that you're not distributing the tension along the incision line. And that's a big problem too, because two incisions here are going to heal worse than one long incision along the entire base of the nose. Because with the long incision, you've distributed the tension, so as it heals, there isn't one area that's sort of stretching more than another area. It's kind of redistributing the tension. That leads usually to worse scarring with the Italian method. So it's not advisable in general. Most lip lift surgeons who do like large volumes of these really don't offer the Italian lip lift for that reason. So it's just something that's been described over the years. The lip lift surgery is not a new surgery. It's been around for about 30 years. It's just becoming more popular now for a couple of reasons. I think first of all, people are just more interested in the lips, right? It used to be that maybe it wasn't as in vogue, but now people want more fullness to their lips. And as more people get filler, they're realizing that's not really giving me the look that I was hoping for. So that's the other thing. And then also our ways of doing the actual surgery and all that post-operative stuff to help it heal, to do things if it doesn't heal great, are all available now. They weren't 30 years ago.
Okay.
So those are the reasons why there's kind of been a resurgence with this surgery. But I mean, it's, the gist of it's been around, and different types of techniques and adjustments have been made over the years. But you're right that the bullhorn is like the most popular method now. And, people doing it start to develop your own little method for it to make it better.
Okay. All right.
Yeah.
And I think we already went over the time that it would take to heal. Now, are you guys aren't open yet, so you guys wouldn't be starting surgeries?
Right. I'm booking into mid to late June, and then beyond that. So I push people back into that time frame. It's because we don't have a date officially assigned from the government for when we can do like that. Forget about just surgery. I mean, even injectables, we don't know. So we're waiting, but it's kind of independent of phase 1. So it's kind of like on its own timetable. So whenever they tell us, great. But I mean, I'm seeing some patients, I'm starting next week in the office, but basically everyone gets screened with like a video consultation first, even if they want to come in, because these longer conversations just easier to have in a more relaxed setting. In the office now, everything, like there's this questionnaires, there's masks, there's like temperature checks. It's just like a whole different protocol these days. Yeah. So yeah, that's kind of it. So I'm guessing that mid to late June I'll be able to operate, but there's no guarantee.
Okay.
Yeah.
And so in just looking at, do you feel like I'd be a good candidate for that? I mean, it's just something I've just started looking into, so
I think you're a good candidate. I think you need to kind of take definitely a conservative approach because of the teeth already being visible, so we just don't want to overexpose and make things look kind of off, where it's just like too toothy. So we just need to keep that in mind. But I would recommend in your situation to dissolve the filler first. Someone asked us earlier, actually, in one of these.
Yeah, I saw that, yeah.
I think it does make sense to dissolve the filler if you look at the person and it just looks like there's some filler in the lips, which, you know, I mean, not everyone can always tell, but I mean, I do this enough where if I can tell that there's something there, it's usually better to dissolve, because then we can more accurately determine the amount that gets removed, because that's permanent, you know, so
Right. Yeah, I wouldn't
filler is
want.
temporary. So I think in many cases it does help to dissolve, but some people don't want to dissolve it. Some people, you know, it's not as obvious, and we can just let it go. So I don't make it an absolute must for folks, but I do think that it helps in many cases, because we want to be accurate.
Okay. Yeah, because that was my concern too, because I have some still there, you know, and it does take long to dissolve out of my lips for some reason.
Yeah, I mean, everyone's different in that sense. There's always some filler that kind of remains, even when it looks like it's flattened down. But, you know, again, it's just some of it is a personal choice. There are some people where I'll strongly recommend it, where it's very distorted from the filler. You're definitely not one of them. And that's, so, I mean, if you wanted to keep them in and still get the lip lift, that's fine. If you wanted to kind of wait and, you know, for it to dissolve naturally, that's okay too. There's different ways to go. But, you know, I think it's nice to dissolve it and really start with like a, you know, blank slate. Yeah, I think so. And then someone asked how long before surgery. I would say 2 times is what I usually recommend. And, you know, you start approximately 2 weeks before surgery. So you do it twice, at least 3 days apart, and then at least a few days before the actual surgery, so that there's not like swelling and things like that.
Okay, that's with the dissolver.
With dissolve, yeah, for people dissolving, yeah. And
Okay.
I can do it for patients who've signed up with me, or, you know, they can go to their dermatologist. You know, some people travel from other states and countries, so like it doesn't make sense for them to come to New York a few weeks before for this. So they just get it locally, and then they come in ready for the procedure.
Okay. Yeah, I know it's a cost too, because my daughter had to dissolve hers once.
Yeah, I mean, for patients who are coming in for surgery, like I don't charge them to dissolve anything.
Okay, yeah, but she paid a lot, and I was like, "Are you crazy?" She
Yeah,
just
I
put it in
usually
and then
charge
took it
like
out.
400. Like if it's just someone coming in just to dissolve something without surgery, I just charge like $400 for that. But yeah, I'm sure people, you know, all types of prices out there.
Yeah, yeah. And she had just got it done, and I was like, "What is wrong with you?" But
Yeah, you
she's
know,
into the filler, but you know, it's not
sometimes,
for me.
yeah, sometimes people try things, it's not for them. That's normal.
Yeah, she just didn't like the way it looked. I guess person she went to, and then you know now she goes crazy with the filler, and I don't like it. So it's just not for me.
Yeah, yeah, I totally get it. I have a lot of patients who are in that same boat. And then I have people who come to me for filler because, you know, I'm very careful with how I do it. And so some people just prefer to take that route. I have some patients who get the lip lift and still come to me for filler, not because they're not happy with surgery, but because the lip lift really changes the shape. You know, it kind of improves the overall shape and proportions. And then if you want more volume, well, then,
You
you know,
still need the lifter. The
trust me,
lip
I don't
filler.
think those people necessarily need the filler, but you know, everyone has their own aesthetic. I think most of them look just fine with just the lift. But you know, again, I can't dictate everything.
Yeah. Well,
So
everybody wants what they want, you know.
I just give advice and suggestions, and you know, and I do what's safe. If something is unsafe or totally, you know, not appropriate, I mean, I won't do it. But you know, there's leeway. I mean, you have to work with patients to achieve their goals.
Right. And I think I have one more question for you. So the stitches that you use, are they dissolvable, or we have to come back to get them out?
The deep stitches are dissolvable, the ones like further inside that you don't see. The ones on the surface come out at 5 days or 6 days typically. So I don't like to go like shorter or longer than that if I can avoid it. That's like kind of a good window there, 5 to 6 days, because you want it there to give you strength, but you don't want them there long enough to give you like railroad track
Holes.
marks.
Yeah. Okay.
Yeah, so yeah, and the suturing there is, you know, it's a very kind of critical sort of area, so it's just done very meticulously, very small suture there.
Okay. Yeah. Because I spoke to someone who said that they give you dissolvable stitches on the top as well, and I didn't really feel comfortable with that.
I will rarely do that for my patients who fly in from like other countries. If they like, you know, they don't have anyone back home who can remove them, and it's just not safe to send them back with stitches that are just permanent. So that's an exception. I tell them that's not my preference. For all my local patients, it's not even a question. We just, you know, do Prolene is the permanent stitch that I use. Yeah, I mean, it doesn't make sense to use dissolvable on everyone, because if you think about it, it's dissolving because the body's attacking it, right, to break it down. As it attacks, it causes more inflammation and redness, and just it doesn't make a ton of sense.
Yeah, and I mean, I'm not a surgeon, but I didn't know if it would be maybe even scar a little more.
It could, yeah. I mean, it's very possible. So I try not to take that chance, when I can avoid it. But the deep stitches are always dissolvable because you don't want to dig anything out, So
Right.
those are a bit, stronger too, but they dissolve. I use a mix of two different types of deep sutures, just depending on where I need more strength and if I can get away with a suture that's less strong. And the reason is because that dissolves faster. So it's a little bit easier for the recovery. So you're kind of like balancing. You can use very strong deep sutures, but then they take forever to dissolve. And then sometimes you get little bumps that form as it's dissolving because the stitch can unravel and sort of come out the skin. So I've moved away from the really strong stitch all across, and I try to kind of balance the two, a stronger stitch and a less strong stitch next to it. But it's for that reason, to kind of create a slightly more tolerable recovery.
Oh, okay. Great.
So it feels less tight for less period of time, because it's always going to feel a bit tight here for it could be months. Sometimes it's weeks, but it could be months until it starts to, open up again.
Right.
So, but I I don't want people forcing past that tight feeling, because that's what it's doing as it's healing. So you don't want to kind of force it open and then create problems at the incision line. But it's not typically something that bothers my patients.
Okay, yeah. So that was my main concern, was just more of the scarring, the distortion of the nose, you know what I mean?
Yeah.
Because, yeah, that I did see in some pictures, and I was like, wow, that it does show.
Yeah, it depends on sort of how concerned, like everyone has different things that are important to them. Some people are so fixated on the lips, they don't really care what else is going on. Others, they really don't want their nose to have any distortion. And I would say many times, like 7 to 8 out of 10, I don't see any changes to the nose. But, in the rest, I definitely see some slight changes in this dimension. Sometimes extremely slight, but if you're looking for it and if you're going to compare the pictures, you might find that. So
yeah,
it's just, you have to kind of accept that as a real possibility, before getting this type of surgery. And it's not just in my hands. I mean, my, friends around the country who do a lot of these, it's same issue. There's no magic. I mean, you're suturing to the base of the nose. Doesn't matter how deep you secure the stitch, gravity still can take hold. So.
Right. Yeah,
The more robust, I find that the more robust the tissue is at the sill, the better it holds. So if someone has a very flimsy sill and there's not much to kind of latch onto with the stitch, it's going to be flimsy, and it's a higher likelihood of it sort of descending down a little bit. But that, that's kind of a more advanced thing, and I don't typically point that out to people. Oh, yours is robust and yours isn't. I don't really
would you
look
know
for
that?
No, I kind of just, it goes through my mind when I'm operating as I'm putting the stitch in, but I don't really think about it, because again, if it bothered a lot of people afterwards, I probably would think about it before surgery. But I honestly, I mean, the only real complaint I've gotten from some patients is either the lip has gotten a little longer over time, like over the course of a year, they've gained like say 2 millimeters and they're upset, even though their tooth show is great and their lip eversion is great, but this distance will elongate to some degree over time. And we don't know who's gonna, just like a facelift. I mean, some people just stretch out a little more quicker than others, even if it was a good facelift. So same thing here. So they'll get upset, and then we sometimes have to do, a little revision, which is possible. And then other people just at the incision line, they're just not totally happy with the actual scarring. And again, it's a real thing and it can happen. But that's, again, a minority of people. I mean, I would say under 5%, which is really good for this, for a procedure done in the center of the face. But again, I don't try to sugarcoat anything. I mean, I tell people the real risks of filler too, which some people don't want to hear about. But there are real risks, I mean, to any of this stuff, and just because it's less invasive doesn't mean it's less dangerous. And a lip lift is real surgery. So, as long as people come into it with the real understanding possible risks and all that, but, with reasonable goals in mind, which you have, it's process is overall a nice kind of straightforward process. It's not a terrible recovery or anything like that.
Yeah, it looks really pretty. I mean, they do look nice.
Yeah, I mean,
Looks very
again, my
natural.
patients are generally very happy. I mean, that's why I keep doing the procedure. If it was something that, didn't yield, I actually don't do much of certain types of facial procedures because of, satisfaction rates, not just in my hands, but in general being kind of low. I'll give you an example, buccal fat removal. Stop doing that because for the most part, I just found that it just wasn't yielding results that I found to be totally predictable and that patients were consistently happy with. And it has some long-term potential issues too, because you're removing fat that you might want later in life.
Yeah, I didn't understand that one. I saw that and I said, well, why do they want to remove the fat? I mean, is that
Exactly.
like a younger population that
Yeah,
asks for this?
it's people with like fuller cheeks and they think, oh, well, I want to do something to like slim it down. But the answer honestly isn't always the buccal fat because there's other fat compartments of the cheeks of the face. So that's not enough usually to give a huge difference. And sometimes it can be the opposite problem where you over resect and now they've kind of like made them too thin here and you can't really put it back.
Oh
So
gosh.
so I'm just giving an example of procedure, that just didn't make sense to do, I thought. Just because it's like a procedure that's been described and that other people do doesn't mean that it has to be done by everyone. So I kind of stopped that one. So yeah, so I mean, I just, I love doing like rhinoplasties. I do hair transplants too, but different things because they make people happy. They're fairly consistent and reproducible in results, and that's what I'd rather kind of stick to.
Okay. Yeah, I saw your work is beautiful. I mean, I
Thank
look
you.
at it's really, really nice.
Thank you.
And there's not a lot of people that do those. There are not a lot.
Yeah, no, I think you're right. I think you're right. And I try to show, I mean, there's nothing Photoshop. It's like, this is what you have. I try to keep the lighting as even as I can. I mean, it's not always possible, but at least I think, you can tell which surgeons are trying and which like don't care. And they'll post something like in the dark. It's like,
Yeah.
hidden face. And then all of a sudden it's like bright lights and everything looks amazing with makeup. And it's hard to kind of compare like was that the surgery or is that just the lighting or the makeup?
Exactly. Yeah. You're looking at them, you're like, is that, and what's also important is to know how post it is too.
Yeah. Yeah, true.
So I've been looking at that to see like, okay, it looks like this after 3 months or this after 6 months.
No, you're right. And some people just don't come back after some time. So it's hard to always get those like year out, whatever. But I definitely think they're extremely valuable to show people what can happen for better or worse. I mean, if this distance got bigger, people should know that's possible. If the scar just started to disappear and look great, people should know like that's kind of what ends up happening. I mean, surgery to some degree can be unpredictable, but I think in the right hands and kind of really thinking it through and how it might look on you, all of that, kind of amounts to at least having a really good idea of how the whole process will go.
Right. Okay.
Yeah.
Well, I think that was it. Yeah. That was my main, I really didn't have a lot of questions because I've done like a lot of
good for you
around. So once I get involved in something, I start like really researching. So
I mean, you have to, right? I mean, this is a big thing. So yeah, no, I appreciate you coming on with me like this. I think it's great for people to see, kind of like, all the little details that are important. Especially, I find that with these Insta Lives with my new patients, I've only started doing it, like a couple months ago, but I think it's been really interesting. Most of the patients who come on are like very educated in like the procedures that they're looking for. And that's really the type of patient that I try to attract into my practice. Because if they've never if they just like heard about it, I don't want them coming to the office. I mean, it's going to be a waste of time, like for both of us, because I'm going to have so much to explain. And, it's like you have to do your research and then come prepared. And so it's been actually a really rewarding process. But thanks for doing this. It helps a lot of people.
No, thank you. Thank you. I appreciate it. Appreciate you
Sure.
taking the time out as well to answer questions. It's amazing.
Of course. So I'm happy to chat again, kind of off the record, and we can see if it makes sense for you and timing and all of that. But yeah, we'll be in touch. I know you're local, so
yeah, I'm here.
All right. Well, sounds good.
Hopefully you're fully operating soon.
I hope so. It's been too long. It's like very weird. It's like taking the the cooking stuff out of like a chef's hands, and then
I know.
So it's very strange, but we'll be back at it I think soon. So
And you'll be very busy.
Yeah, yeah, it's building up for sure. It's like,
Yeah.
yeah, the list grows, but it's a good thing. You'll have to work pretty hard
Yeah.
over the summer. So yeah.
Yeah, we'll be getting back to work too. I don't think we're going to be getting back to work anytime soon. So
Which type of?
I'm a personal trainer, so we're going to be the last phase to
Do you
go.
have to see clients in person?
Yes. So
Okay.
we're going to be the last, but
That's
what are you
gonna be
gonna do?
tough. But yeah, I mean, it's just one big adjustment, and yeah, I don't know. I've tried to just look for the silver lining in all this, and it's been like
Yeah, I mean,
spending time at home and watching my daughter grow, and she's 10 months
yeah.
tomorrow. So it's,
I saw your pictures. Oh, she's so cute. So
thank
cute.
you, thank you. So it's
So cute.
exciting, and yeah, so just making the best of it.
Yeah, we're doing the same thing, doing things that we always say we don't have time for. So at least I've gotten a lot accomplished, while I've been home. I
Yeah,
haven't just been sitting down watching Netflix. So
right. Well, yeah, I've done a lot of that too, though.
yeah, I started doing that, and then I said, I can't do this.
Right.
Because
No,
I'm not the television type anyway, but I did a few series, and then I
it's
said,
good
okay,
to feel
we're done.
productive, but Money Heist is really good.
Oh yeah, you know what? I saw that on there, but I don't know. Like I said, I've been trying to stay away.
Okay, fair enough. Yeah, it'll kind of draw you in, and then you'll just keep watching through the
Yeah. Then before I know it, I'll be sitting on the sofa for 5 or 6 hours, and
I know it's kind of because they keep playing it, right? You stop one, you finish one episode,
and then
it
you're
keeps
like,
going.
oh, I want to watch it again. I want to watch the next episode. Do you want to stay and watch the next one? It's 11 o'clock
It
at
just
night.
keeps scrolling through. It's like genius. I mean, but
Yeah.
they don't even show ads, so I don't know. But they keep definitely people glued to the TV.
Yeah. Did you see Ozark?
No,
Oh,
I never did.
well, if
It's
you,
good.
yes, amazing. So if you're looking to watch something,
Yeah, maybe
check that one
that'll be the
out.
next one. Yeah, there's
You'll be
Tiger
hooked.
King.
That one actually hooked me. I couldn't stop watching it. So
Wow.
yeah, that one was like, you want to watch the next one? It was just so entertaining.
Yeah, I mean they have some really incredible shows.
Yeah, it was a lot of bad stuff, but so bad that it was so good, kind of stuff. That you're like, I gotta see what happens next. I gotta see
Their
this.
life is so different from ours that it's like this excitement,
Yeah.
Yeah.
So if you're browsing and you see it, take a look at that one.
Yeah, I'm gonna keep it in mind. Thanks.
Yeah. But I'll definitely be in touch.
Yeah.
And like
good.
I said, hopefully you guys are back soon, and
Yeah.
I'll be in touch with you guys.
Sounds good. Okay, thanks, Annette. Take
All
care.
right, thank you.
Stay
You
safe.
too.
Okay,
you
thank
too.
you. All right, see you.
Bye-bye.